I'm going to start by finding the landmarks of your thyroid cartilage. I'm going to move down and find your cricoid cartilage, your tracheal rings. I'm going to place my hands on either side of your trachea, checking for symmetry and lumps or nodules. And I'm going to have you swallow. I'm going to have you turn your head to the left and swallow. Turn your head to the right and swallow. Okay, those movements were all symmetrical. Did you have any pain or tenderness with any of those movements?
No.
I am going to now look at the symmetry of your trachea. It is midline with no edema or erythema. Now I'm going to assess your ears. Have you had any pain, any drainage of note lately?
No.
Okay. Have you had any balance issues, dizziness, lightheadedness, vertigo, which is the room spinning, or tinnitus, which is ringing in your ears?
I have not.
Okay. I'm going to begin by palpating around your ears just to feel for any nodules, lumps, and please let me know if there's any tenderness as I'm palpating. Any pain as I tug on your earlobe?
No.
As I move your auricle back?
No.
Okay. I am going to test for auditory acuity. I'm going to have you occlude your ear, and I'm going to whisper in your other ear and you tell me what you hear, okay?
I like dogs.
Okay, let's go to the other ear. I'm going to whisper something.
I love pizza.
Okay, very good. You have positive auditory acuity, bilateral. I am going to press on your tragus and press on your tragus and your mastoid. Is there any pain as I press on those?
No.
Okay, there's no lumps or edema to be noted. I am going to do the Weber test, and to do this test I'm going to make it vibrate on my hand and put it in the middle of your head, and I want you to tell me if you can hear the vibration bilaterally or if one side is louder than the other side, okay?
The right side.
The right side is louder than the left side?
Yes, yes.
Okay. So the Weber test is not equal bilaterally. The right side is louder than the left side. Now I'm going to do the Rennie test, and to do this test I'm going to do the same vibration. I'm going to put the this end of the tuning fork on your mastoid, and please let me know when you do not hear the vibration any longer, and I'm going to move it to the front, and then again you tell me when you don't hear the vibration, okay?
Okay. Okay.
Okay, so air conduction is greater than bone conduction by 9 seconds. Okay. Yes.
It's right there.
Thank you. I'm going to use my otoscope to look inside your ear. I'm going to be checking the tympanic membrane to make sure it's, see what color it is. I'm going to check for extra ceramin. I'll make sure I can see the optic cone and the malleus. I'm going to gently pull your auricle up and back and put this inside your ear canal. Okay, you see the tympanic membrane is a gray color. There's not an excess of ceramin, There's no inflammation or redness. I see the optic light and the malleus. I'm going to move to the other side and do the same thing. I'm going to pull up on your auricle. Tympanic membrane is gray. There's no cerumen, no inflammation or nodules. I'm going to assess your nose, and I'm going to do that first by palpating, just to see if there's any tenderness or lumps. Any tenderness as I palpate?
No.
Okay. I'm going to check for symmetry, as just you'll look up. Okay, the right nair is slightly larger than the left, but that is normal. I am going to check for patency. I'm going to lightly press on one side of your nose and you breathe through the other. Okay, I'm going to do the other side. Okay. Now I'm going to use the light and assess your nasal mucosa. I want it to be pink and moist. No ulcerations or abrasions. Septum is midline. There are no polyps. We'll go to the other side. There's no ulcerations, no polyps, and septum is midline. I'm now going to palpate your sinuses. I'm going to first palpate your frontal sinuses, which are right by your eyebrow. Any pain as I palpate?
No.
No, there are no nodules, no edema or erythema. I'm going to check your frontal sinuses, which are by your cheekbones. So I'm going to palpate right here. Any pain or tenderness?
No.
Okay. There are no nodules, no edema or erythema. Now I'm going to transilluminate your sinuses. So I'm going to use my pen light and place it below your brow and point it upwards so I can see if there's any shadowing, which would indicate inflammation of your sinuses. Okay? Okay, there's no shadowing. I'm going to come over here and do the same thing. All right. Transillumination is bilateral on your frontal sinuses, and there's no shadow, so there's no inflammation. I'm going to do the same thing on your maxillary. And so I'm going to put the light right here on your cheekbone, and I need you to open your mouth so I can... Okay, transillumination is present. No shadowing. Okay, present and no shadowing, which indicates no inflammation of your sinuses.